The CDC is getting a little too excited about how well the vaccine rollout is going and how successful it is. It's now decided it is not going to track any mild cases of COVID in fully vaccinated people. So the Centers for Disease Control and Prevention has stopped investigating breakthrough infections among fully vaccinated people unless they become so sick as they need to be hospitalized or die. The breakthrough infection, just their words, is when a fully vaccinated person becomes infected with COVID-19. The new CDC reports show that such a breakthrough infection may occur in just 0.01% of all fully vaccinated people. The rationale for this change is to focus on cases that are of most importance to public health. It's not a resource limitation question, said Tom Clark, MD, MPH, Deputy Director of the Division of Viral Diseases at the CDC and lead of the agency's vaccine evaluation team. Okay, I read this and I'm like, why? Why would we stop tracking COVID cases in fully vaccinated people? And I can't help but think that maybe it's because, I don't know, maybe because they don't want to admit that some people, 0.01% of people are getting COVID, because again, they're trying to bolster the vaccine for people who are reticent and don't want to get it. But it makes no sense because we still don't know. We don't know how long the vaccine actually is good for. We don't know when we're going to be needing booster shots, and we don't know how effective it is against all the variants. We do know it is effective against most of the variants, and it turns out that the people who have been fully vaccinated, who have received or who have gotten COVID, have one of the variants. And again, these are in large part mild cases. The problem is that mild cases could potentially still spread. It just makes no sense in my mind why you wouldn't track them. Look, the US is averaging about 30,000 COVID cases a day still. That is way down. It's probably the lowest it's been, I believe, for 11 months. So we're almost a year, over a year into this. We're at the lowest we've been since then, but 30,000 is still a lot. Now, a lot of that is, of course, among unvaccinated people. Currently, only 50% of Americans have gotten one shot, 40% are fully vaccinated. And we know, we've talked about it on the show before, we're not gonna reach that herd immunity. We're still having to convince people to get vaccinated. But I think the more honest the CDC can be about the reality that, yeah, there is a slim chance there are people who still get COVID, and to track that, where were they? Were they indoors, right? Were they in touch with children who, like I've said on the show before, are just walking piles of phlegm? How did they get infected? I'm curious. It shouldn't just be left to when they are hospitalized. But maybe this is also a sign that COVID is becoming less and less of this pandemic and more of an endemic flu type situation, and sort of what right wingers always imagined it was going to be, even though they're not getting vaccinated either. I just want to read about how many people have actually been infected with COVID, even though they got vaccinated. Earlier this year, the agency was monitoring all cases. Through the end of April, when some 101 million Americans had been vaccinated, the CDC had received 10,262 reports of breakthrough infections, they're calling them, from 46 states and territories, a number that was very likely a, quote, substantial undercount. So that's another reason, another thing is Bill Maher got COVID and he didn't have symptoms. He was just testing every day. So a lot of folks might have undetected COVID. Not all scientists, it's not just me who's questioning this, guys. I know I like to imagine myself a scientist, but some scientists are unhappy with this. This is according to Michael Kinch of Washington University. Understanding as much as we can about breakthrough cases is essential, they said. I'm not supportive of this change. I'd rather err on the side of having too much information, he told MedPage today. My worry is that missing variants could potentially evade the effectiveness of vaccines. When we find a variant like that, we want to snuff it out as quickly as we can. Because this is more context, because the viral strain may cause only mild illness in one person, but deadly illness in another. Not tracking mild breakthrough cases could risk missing out on the full picture of the SARS-CoV-2 infection, he added. Of course, right wingers, when you start tracking mild COVID cases, will say, oh, look at how many people have COVID, even though they got vaccinated. Again, mild is the key phrase not clogging hospitals, not needing like any kind of emergency action, not being put on a ventilator, and obviously not dying. And that is huge. And so the benefits of this is not calling into question the benefits of the vaccine at all. It is not calling into question the cost benefit of having a day in bed versus months and months of COVID. But there have been cases of people who've been fully vaccinated who did get COVID, who are struggling with the long-term consequences. Another thing of part of this, and I'm sure we all know folks who have long COVID who've survived, but they still have effects, right? They're still being impacted. They've also gotten vaccinated, unlike Rand Paul, who somehow thinks because he got it, he's immune, which is not actually true. But we should be studying that. So I don't know. I think the CDC, between the no mask mandate indoors and this, I feel like they're a little bit on one. They're a little bit like, I don't know, they've had too much vaccine. They're floating on that, that extra Pfizer high. They got like a third dose and it's put them in some weird headspace. So yeah, I'm not really sure how I feel about that.
For more political news breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/thedamagereport. And you can ring the bell wherever it is so you don't miss anything.